Hello everyone, I'm Dr. Catherine Chan from the Department of Otorhinolaryngology, Head and Neck Surgery, the Chinese University of Hong Kong, with the joint efforts from the clinicians, radiotherapists, and radiologists from the Chinese University of Hong Kong, Hong Kong Polytechnic University, and the University of Hong Kong. We would like to share with you all an extensive review on the applications of metastatic lymph node-based radiomic assessment in nasopharyngeal carcinoma. Nasopharyngeal carcinoma, NPC, has a distinct geographic prevalence in southern China and Southeast Asia, with a high overall survival rate in the case of early stage of the disease. However, almost 85% of patients suffer from locally advanced disease with nodal metastasis at the time of diagnosis. The overall survival rate would drastically drop to 63% from 90%. In addition to the generic tumor, nodal, and metastasis TNM staging, radiomic study focusing on primary nasopharyngeal tumor has gained attention in the precision medicine, with the use of artificial intelligence technology. While the heterogeneous presentation of cervical lymphadenopathy in locally advanced NPC patients is still currently regarded as the same clinical staging under the TNM criteria, radiomic analysis provides more insight in risk stratification, treatment differentiation, and survival prediction. However, there appears to be a lack of review which consolidate radiomics-related studies on lymph node metastasis in NPC. That's why the aim of this paper is to summarize the state-of-the-art of radiomic for lymph node analysis in nasopharyngeal carcinoma, including its potential use in prognostic prediction, treatment response, and overall survival for NPC patients with lymph node metastasis. The term radiomics is regarded as novel among clinicians. It is often misunderstood as synonyms and interchangeable with artificial intelligence, machine learning, and deep learning. Artificial intelligence, AI, is a big umbrella term and is a constantly evolving technology. Machine learning is a branch of AI using algorithm system to perform tasks such as prediction and diagnosis of interest. So in this article, in the figure attached here, the central umbrella term in the blue shaded region is called artificial intelligence. It branches out with different algorithms using machine learning techniques to predict or diagnose of regions of interest. Furthermore, to extend the idea, deep learning is also called as deep neural network learning, employs a neural network to allow automatic learning capability, mimicking a learning process in the human brain. Radiomics is a quantitative approach which models are built based on high-dimensional spatial features in medical imaging that are not visually perceptible or interpretable by human beings. Radiomics is a high-frequency lexicon in oncological medicine. It requires the acquisition, pre-processing, and extraction of huge amount of data in the medical images for quantitative analysis, providing additional information based on the difference in tumor characteristics such as shapes and textures. In radiomics, a large amount of features are generated to determine the nonlinear relationship between them. So with AI development, computer scientists adopt deep learning algorithms and machine learning methods for tumor segmentation, feature extraction and selection, and finally formulating a model for analysis. Here comes with the radiomics. A literature search was conducted to retrieve all studies of NPC with nodal metastasis under radiomic analysis. Keywords were combined using Boolean logic to produce the resulting search phrase as shown in the slides. Using this search phrase, studies were searched on PubMed, Ovid Medline, and Embase between January 2002 to June 2022. The studies were screened with duplicate removed. Inclusion and exclusion criteria were defined to allow evaluation only on those applying radiomics in NPC with nodal metastasis, which is shown in Table A. In Table 1, authors look into the methodology, image segmentation methods of individual studies. Studies with lymph node-based radiomic analysis as region of interest were included. Studies that are limited to primary tumor as region of interest or those without detailed description on lymph node analysis were all excluded. As a result, 14 studies were selected to highlight the current state of art of lymph node-based radiomics application in NPC. In our review, studies specifically on lymph node metastasis in NPC for radiomic analysis were selected with different objectives towards risk stratification, treatment response option prediction, and survival predictions. The application of machine learning for clinical management of NPC commenced more than a decade ago. Recently, there is a shift of interest from gross primary tumor volume to cervical lymphadenopathy in NPC patients for imaging analysis. Studies of radiomics targeting lymph node metastasis in NPC have drawn researchers' attention. Despite more studies nowadays being published on radiomics of lymph node analysis in nasopharyngeal carcinoma, they are often piecemeal and fall short of knowledge building in the area of NPC management. As a clinician, the concept of radiomics and deep learning in NPC appear to be a black box compared to a traditional statistical models for the prediction and survival analysis. The lack of understanding and explanation of how the model was built by image feature selection and algorithm raised clinicians' skepticism about the generated results. To critically analyze the pitfall of these studies becomes very difficult from a clinician's point of view, creating a huge resistance in translating these findings into real clinical applications. This paper attempts to review and classify relevant literatures according to the clinical use. Therefore, the knowledge could be better integrated for unleashing the future potential of radiomics in the treatment of NPC with lymph node metastasis. There is so far no consensus to interpret the NPC nodal metastasis within the imaging study. Whether the number of lymph nodes, its size, radiological features of malignant nodal lesions, such as the presence of extranodal extensions, that would affect the radiomic models. The major future direction of radiomic studies are to address the issues of batch effects in image acquisition and feature extraction standardization, ultimately to improve radiomics reproducibility and generalizability. This review presented a summary of the fast application of artificial intelligence in using radiomics and deep learning analysis on lymph node metastasis for advanced NPC patients. With the emergence of technologies in the radiomic features application, deep learning models have been readily developed and validated with good accuracy in auto-segmentation for tumor staging, treatment planning, risk stratification for providing more personalized treatment options, and predicting the overall disease-free survival. Hope you enjoy our review, and please take the time to take a look at details, more information in the literature. Thank you.